Ever wondered why isotretinoin has such a controversial reputation? This little molecule has been the center of many debates, often shrouded in myths and propaganda. Isotretinoin, often known by its brand name Accutane, is widely used for acne treatment. But why does it stir up such a storm of controversy? Here's the thing. Isotretinoin is not your average over-the-counter acne remedy. It's a potent drug with a list of potential side effects that can sound quite daunting. This has led to a host of tales, some grounded in fact, others woven from pure fiction. Our goal today is not to add to the noise but to clear the air. We're going to sift through the chatter, separate fact from fiction, and lay bare the truth about isotretinoin. So buckle up and prepare for a myth-busting journey. Let's dive into the world of isotretinoin and debunk these myths. First off, the most popular myth. Isotretinoin, also known as Accutane, supposedly causes severe depression. This claim has been tossed around for quite some time, but let's look at the facts, shall we? Numerous studies have been conducted to investigate this supposed link between isotretinoin and depression. The overall consensus: there is no substantial evidence to support this claim. A review of 30 years of research published in the Journal of the American Academy of Dermatology found no increased risk of depression among patients taking isotretinoin compared to the general population. Now, this doesn't mean that depression isn't a serious issue, or that it can't coexist with acne treatment, but it's crucial to understand that correlation does not imply causation. In other words, just because two things occur together doesn't mean that one causes the other. It's also worth noting that acne itself can have a significant impact on mental health. The American Academy of Dermatology Association has reported that people with acne can often feel embarrassed, less social, and generally less happy. So it's not entirely out of the question that some people taking isotretinoin for severe acne might also be dealing with depression. However, it's not the medication causing the depression, but rather the acne itself or other individual factors. This is why it's so important to consider individual medical histories. Everyone is different, and what works well for one person might not work for another. If you're considering isotretinoin, it's vital to discuss your full medical history with your doctor. They can help you weigh the potential benefits and risks, considering all aspects of your health, not just your skin. Remember, isotretinoin is a powerful drug, and it's not for everyone. But it's also not the depression-causing monster it's often made out to be. As with any medication, it comes with potential side effects and should be taken under the guidance of a healthcare professional. So, no, isotretinoin doesn't directly cause depression, but always consult your doctor. Next up, the belief that isotretinoin will make your skin extremely sensitive to the sun. Now, this isn't complete fiction, but it's not as dire as some might have you believe. Isotretinoin can indeed increase your skin's sensitivity to sunlight. But let's put it into perspective. When we say sensitivity, we're talking about a heightened risk of sunburn and possibly some extra dryness. This doesn't mean you'll turn into a vampire, avoiding daylight at all costs. It simply means you might need to be a bit more careful about sun protection than you usually are. So, how does one manage this? Well, it's not rocket science. Slathering on a good sunscreen, opting for protective clothing, and avoiding peak sun hours can do wonders in keeping your skin safe. In essence, isotretinoin and the sun are not the best of friends, but they're not sworn enemies either. It's all about balance and taking the necessary precautions. So yes, isotretinoin can make your skin more sun-sensitive, but it's manageable with the right precautions. Another myth that often scares people is that isotretinoin can cause infertility. This claim, however, is more fiction than fact. When it comes to isotretinoin and infertility, the scientific community has yet to find any substantial evidence that supports this claim. Let's delve a little deeper. Isotretinoin, primarily known for its use in treating severe acne, has been the subject of numerous studies. However, the link between isotretinoin and infertility continues to be a topic of debate due to a lack of concrete proof. Some may argue that isotretinoin causes alterations in menstrual cycles, leading to potential fertility issues. However, these alterations are often temporary and normalize once the medication is stopped. Therefore, to label isotretinoin as a cause for infertility is not only misleading, but also devoid of any scientific backing. It's easy to get caught up in the whirlwind of misinformation, especially when it comes to health and wellness. The internet is rife with horror stories and sensational claims, and it can be challenging to separate fact from fiction. but it's essential to always rely on verified scientific research and to consult with healthcare professionals before making any conclusions about medication and its potential side effects. In the case of isotretinoin, it's clear that the myth of causing infertility is just that, a myth. It's a misconception fueled by fear and misunderstanding, not by solid evidence. However, it's also important to note that all medications come with potential side effects. Isotretinoin, for instance, may cause dry skin, nosebleeds, and sensitivity to the sun. But infertility, the science simply doesn't back it up. That said, it's always crucial to discuss any concerns with your doctor before starting a new medication. They can provide accurate information and help you understand the potential risks and benefits associated with the treatment. So, isotretinoin doesn't cause infertility, but always remember to get your facts right. It's your health after all, and you deserve to make decisions based on truth, not fear or misinformation. Lastly, the myth that isotretinoin is a permanent cure for acne. Let's delve into this, shall we? Isotretinoin, widely known as Accutane, is a powerful drug used to treat severe cases of acne. This potent medication operates by reducing the amount of oil released by oil glands in your skin, helping your skin renew itself more quickly. However, the idea that it's a foolproof, everlasting solution to acne is somewhat of a tall tale. While isotretinoin can be incredibly effective in treating severe acne, it doesn't necessarily mean it's a permanent fix. Why, you ask? Well, let's break it down. The human body is an intricate system, and the skin, being the largest organ, is no exception. It's constantly changing and adapting, reacting to internal factors like hormones and external factors like diet and environment. Acne, as we know, is a result of these complex interactions and can be influenced by many variables. Isotretinoin's primary role is to shrink the oil glands in the skin, thus reducing the amount of oil produced. This, in turn, helps to decrease inflammation and the number of bacteria on the skin. While the drug can have long-lasting effects, the possibility of acne recurrence exists. It's important to note that everyone's skin responds differently to treatment. Some people may experience a complete remission of their acne after a single course of isotretinoin. Others may see a significant improvement but might need additional treatments in the future. And in some unfortunate instances, acne might reappear a few months or years after treatment. Moreover, effects of isotretinoin can vary based on dosage and length of treatment. A lower dosage over a longer period might minimize side effects but could also increase the likelihood of acne recurrence. Conversely, a higher dosage might lead to more severe side effects but could potentially offer more lasting results. So, as effective as it can be, isotretinoin isn't a guaranteed one-time solution to acne. It's a powerful tool in the battle against severe acne, but it's not a magic bullet. It's always wise to have a candid conversation with your healthcare provider about what to expect from isotretinoin treatment. So, we've debunked some popular myths about isotretinoin today. We've journeyed through the enigma of isotretinoin, unpacking the facts and falsehoods that surround this much talked about drug. We've delved into the Accutane Apocalypse, debunking the myth that this medication is a harbinger of doom for your skin. Instead, we've unveiled its potential as a powerful ally in battling severe acne when used under the right circumstances and with the correct guidance. Our expedition took us to the Sun Sensitivity Saga, where we shone a light on the truth. Yes, isotretinoin can increase your skin's sensitivity to the sun, but with careful management and the right protection, it's a manageable side effect. In the Infertility Illusion, we busted the myth that isotretinoin leads to infertility. While the drug should not be taken during pregnancy due to its potential to cause birth defects, there is no concrete evidence to support the claim that it causes infertility in the long term. And finally, in the Permanent Cure Conundrum, we address the belief that isotretinoin is a one-stop solution for acne. While it can indeed lead to long-term remission in many cases, it's not a guaranteed permanent cure. Each individual's response to the drug is unique, and some may require additional or ongoing treatment. Throughout this journey, the importance of seeking professional medical advice before starting isotretinoin has been a recurring theme. This medication, like any other, should be used with caution and under the guidance of a healthcare professional. It's crucial to have a thorough understanding of the potential benefits and risks, side effects, and necessary precautions before embarking on this treatment journey. In the end, the Isotretinoin Intrigue is a reminder that health and medical information is often complex and nuanced. It's not always black and white, and what works for one person may not work for another. Remember, when it comes to your health, always rely on facts, not myths. Until next time, stay informed and stay healthy.